Hey, folks. First, I want to say thank you very much for stopping by to watch or listen to this podcast. I know there's a lot of podcasts out there, and you could be listening or watching to one of those. So, thank you again. If you haven't been here before, my name is Chuck Tuck, and I'm the host. So, today I've got an important podcast, or I feel that it's very important because it's something that I think a lot of women, men more than women, just don't know much about, and that is lactation or lactation consultant. So, what is a lactation consultant? You'll find out today with my guest. My guest today is Nicole Salter, and she has a company, a business called Thrive Lactation Consultants.com. Nicole, welcome and thanks for joining us today. And thanks for in advance for giving us some information on what this is all about.
Yeah, thank
So,
you so much for having me. I'm super excited. I'm very passionate about lactation and supporting families. So, any chance we get an opportunity to talk to people and tell people what it is, what we do, I love it. So, yeah, I'm a registered nurse. I'm going on about 30 years of nursing, but I'm also an international board certified lactation consultant, IBCLC for short. We study and train for hundreds and upwards to over 1,000 hours to help families feed their new babies, and we support families from hours after birth through weaning, and that could be a really long journey for some and shorter for others, but we love watching these relationships blossom. And I think families spend a lot of time preparing for labor and birth, and I am a former L&D nurse as well. I've spent most of my career in women's health, but while I always loved families being really prepared for labor and birth, we spend way more time feeding these small humans than we do birthing them, and a lot of people don't think to get some education or some guidance before the baby arrives, and then they come and see us a little while later and we're putting out fires and trying to fix issues. So some of my favorite things are working with families before babies arrive, and it might seem like, what on earth could we be doing before they arrive? But there's lots of education. There's so many myths and old wives' tales about things to prepare for, and breastfeeding, it's just going to hurt, and nipples are going to bleed, and it's just going to be really hard. But I like to prep people so that they know that that's actually not normal. It's really common, but it isn't normal. And I love that we hopefully will have some dads and male partners and fathers to be listening to this, because I always say that breastfeeding, baby feeding, whatever type of feeding a family chooses, this is a team sport, and we need both parents, all parents, involved to help, because it's a huge undertaking for new moms to do all of the things while they're healing from birth, and maybe also from surgery if they had a C-section, and they have increased demands on them physically, emotionally, and they're doing it all with a whole lot less sleep. So, it's not just about how to feed a baby, but how to support the parent that is feeding the baby.
yeah. Guys, this doesn't happen magically. Kind of, sort of, maybe does, but to understand this, it is like a biological process that moms go through, and it happens in their mammary glands, and there's some, what do you want to call it? Some hormonal changes, if you call it that. And please correct me if I'm wrong, but they go through like this hormonal process, and there's stuff called like what is it? Prolactin
Yes.
and
Yep.
oxytocin, not oxycontin, guys, oxytocin. So
Yeah.
it's this process that the women go through. What leads me to ask on this part, I'm just going to generalize. Young moms, dads, people, all of us, we eat a lot of junk, and there's a lot of processed foods out there and a lot of junk. And if this is a hormonal process and it's going to the mom, and then they're going to potentially feed it to their child, should they be aware of their diet and things like that? Is that something to look to?
It probably would not be my number one top priority. And the reason for that is it's probably much more important during pregnancy, when we have a developing baby growing, and so many important things are developing in utero during pregnancy. But after delivery, a lot of things change, and everything that we consume, whether it's food, alcohol, medication, those types of things, they all have what's called a molecular weight, and molecular weight refers to just how big or small are the molecules of that particular substance. So not everything we consume actually even passes into breast milk because of its molecular weight. It might be too large to get through, and things that can get through, they don't necessarily go through 100%. And things that do get through, that molecular weight that will pass through into breast milk, it's often in and out of breast milk fairly quickly. So I like to think that, or we tend to say that for a mom, your breast milk is perfect. Your body knows how to produce perfect milk for your baby. It is the perfect food. And we don't have, the most fantastic diet, and actually just getting enough to eat sometimes is challenging for new moms because they're so caught up in infant care, and maybe they're going to choose that time when they're not looking after their baby to take a nap or to have a shower. They might not even be thinking about their own nourishment. So most of the times what they're consuming is a lot less of a concern or an issue in breastfeeding than it is in pregnancy. We do have a few, obviously, medications, that are not breastfeeding compatible, and we have wonderful resources that families and professionals can look to. It's almost like a poison control for breastfeeding, where they study breast milk, the effects of medications on breast milk, on the breastfed baby, on milk supply, and things like that. So there are really good resources. But generally speaking, babies will always get just what they need from the breast milk. If diet is lacking or hydration is poor, the one who tends to go without or suffer is the mom, usually. Babies always get what they need, and moms will tend to be the ones that bear the brunt of any kind of a nutritional deficit.
Okay, that's good to hear and good to know, but also you do have to take care of yourself, your body as well. Like you
We
said,
do.
that the babies are always going to get what they need from the mom, but the mom needs to take care of themselves. Because I think before we even started, you talked about the lack of sleep and things like that that the moms will go through, and that's probably hard on the body. Not probably, I'm sure it is.
Definitely is. And I usually try to stress that a big piece of infant care or baby care is mom care. If mom is not okay, nobody's okay, right? Who's taking care of this baby if this mom is exhausted? And if she is exhausted and not feeling supported and her hydration and nutritional needs are not getting met, it's really hard for her to take care of another little human, which is why it's great to have partners involved, because while they may not be able to do the actual breastfeeding or the lactating, they can support the person who is. Moms can get caught up in looking after their babies and realize half the day's gone by and they didn't eat, and that I ask them to tally up how much sleep they've had in the last 24 hours, and sometimes I'm hearing 3 hours or 4 hours, and it's broken sleep. And I think that plays a major role in postpartum mood adjustment disorders as well. If you take somebody's sleep away, whether they've just had a baby or not, whether they're going through this hormonal roller coaster of postpartum or not, lack of sleep is a form of torture, and it can impact somebody's mental health really significantly. So if they're not getting enough rest, they're not getting enough sleep, they're not supported or not getting replenished on their own, it plays a big role in mood, which also then, is a cascade of events of how long will these babies be breastfed for. If it's taking a toll on mom, it does reduce risk, or does reduce rates of longevity of breastfeeding when there's not a lot of support, not a lot of rest, not a lot of self-care. So it's huge. They really do need somebody sometimes just to remind them.
Yeah. Well, this leads me to ask this question, which is it's becoming more obvious to me. So the actual question would be, why would a new mom, or shortly becoming a new mom, need a lactate consultant?
Okay, yeah, that's a fantastic question. So number one, beginning with before baby arrives, having an opportunity to sit down and talk about what is your history. Maybe this is the first baby and everything is brand new and unknown and unsure, and they've had the girlfriend reports and they've heard the nightmares and they've heard some of the good stories. Or maybe this is their second or their third baby and they've had a history of challenges, or maybe breastfeeding didn't even work out the first time around. So we can look at prenatally what path did you walk down before? What are your main concerns? We also do breast exams and assess to see, have we got adequate glandular tissue development that's happened in pregnancy? Is the body sort of laying down the groundwork to prepare for breastfeeding?
Playful paws mean responsible hearts. Healthy pets make happy homes. Be a hero for your pet. Choose spay or neuter.
What kind of challenges we might be looking at? And there could be, it could run the gamut between whether there's been injury or surgery in the past, whether there's glandular tissue development issues, maybe some women have a history of hypothyroidism or anemia or PCOS and other types of things, especially anything endocrine. So anything involving the endocrine system, because it's all hormonal and it does impact milk supply. So we chat a lot about that prenatally. Postpartum, we love to see families around day 3 to 5 postpartum. So within that first week after baby arrives, we like to give them a couple of days to get home and let the dust settle. It can take 2 or 3 days, sometimes a little longer, for that mature milk to come in. So we will see families around the 3rd to 5th day postpartum where they can come in and we will weigh those babies and help moms latch and feed their babies, weigh them after. We can actually get like a quantitative measurement of how much milk they're transferring. We can talk about the issues that they've been having and kind of problem solve that. We definitely check in on mood all the time because there is this hormonal fluctuation that's happening all the time. They go from birth and then that umbilical cord is clamped and cut, which creates a pressure change in the body and causes mom, to deliver that placenta, and that kicks off milk production. And so this is a roller coaster of hormones that they're going through in that postpartum period. It impacts mood as they're trying to produce milk and figure out how to take care of this new little person in their world. So a lot of self-care. Sometimes people will come to us and things are going okay in the feeding aspect of postpartum and early parenthood, but mood is, a concern, and maybe they're not doing okay that way. So we do talk a lot about mood and about self-care and what is their support network like. Here in the Pacific Northwest, we have a lot of transplants who don't have family in the area, so we'll often connect people with behavioral health, make sure they're getting their hydration and nutritional needs met and things like that. So self-care is huge, and self-care is not just being able to go out to the store without the baby or be able to do things that the rest of us just take for granted as basic care or chores. Self-care is really about making sure that their mental health is okay, that they're sleeping enough and eating enough, and all of those things are really challenging when you bring a new baby home, whether it's the first baby, which is life altering because you've gone from maybe being a couple to suddenly having this whole other person and your whole world revolves around them, or whether it's the second or third or fourth baby where it's not the first time around, but the demands are huge because you've got toddlers and preschoolers. And, with a first baby, you bring that baby home, and when they rest, we always encourage moms to sleep when baby sleeps. It's not just a thing we say, but it's how we kind of recoup that lost sleep. It seems really hard to do, but when you have a second or a third baby and beyond, that was probably the only one time you could rest when you brought a baby home, because when you have more children, somebody else always needs you when the other one doesn't. So self-care is huge, and so we focus a lot on making sure moms are taken care of. There's that saying, who's holding the mother? Someone's always holding the baby. The baby is always taken care of. Who's holding the mother? Who's making sure she's doing okay? Babies are going to be fine. Everybody's looking after baby. But when people walk through the door to visit and ask, can I see the baby? Who's asking mom, how are you doing? I will ask moms a lot of times, how are you? And she's not stopped to think about how she's doing, and nobody's really asked her how she's doing. We get a lot of tears in lactation care, for sure, because they take that moment and realize, I don't know if I'm doing okay. I'm exhausted, and actually, I haven't thought about it. I haven't had time to think about it, and no one's really asked me how I'm doing. Everybody's very focused on how's the baby. So who's holding the mother? That's huge. Just making sure we're not just all focused on the newborn infant care, but who's taking care of the mother. I also like to make sure that the partners are taken care of too. I will
Yeah.
offer coffee and water to partners because if they're taken care of and replenished, they're able to give those moms a break. So it's a whole team sport. Like I said, it's a family affair.
This really makes me understand why there's a need for lactation consultants. You can, I'm thinking, well, why don't I just go to my regular GP, my general practitioner, my doctor, and ask? You're in the Pacific Northwest, Seattle, Bellevue, Washington area, but you're also available to people throughout the states, everywhere, right? Through your website, consultations, and everything else.
All over the globe, actually. So
Mm.
my private practice clinic is in Pacific Northwest in Western Washington, but as an IBCLC, it's an international board certification, so we can see families and support families through telehealth on a virtual basis as well, anywhere in the world, as long as we can line up time zones. As an RN, I do have an extra expanded scope, and I have a multi-state license, so I can provide that extra piece of nursing assessment and nursing care to almost every state here in the country. But as far as lactation is concerned, it doesn't matter where you are, across town or across country, across the globe. Lactation support is available in person, virtually. It's awesome to be able to have that reach.
Now, can you remind all of us where people can go online to find out more information about you, the other consultants? I believe you have two other consultants.
Sure, yeah. So for my private practice, I'm in partnership with another RN IBCLC. We have our website, thrivelactationconsultants.com. We have a physical space, a beautiful little lactation cottage, I like to think of it as, on the east side in King County. People can also find lactation care near them. They can search things like the IBCLCE, which has information about what an IBCLC is, how to connect with one locally. Most IBCLCs can work through insurance as well, so we are partnered with an organization that allows us to help see families for most plans with nothing out of pocket, which is really nice. They can just schedule with us, see us, and come and go as they need to and not have to pay anything out of pocket or be reimbursed. So that's one really nice way that we've been able to reduce barriers to care for families as well.
There's a couple of questions that I'd like to ask, and you kind of touched on both a little bit. I'll never experience this, of course, but is it normal to feel pain while breastfeeding? Because I'm just going to pretend that I understand what a woman is going through. And I think a lot of times, this is again just me thinking, that a lot of times women might say, it's kind of uncomfortable, so I'm not going to bring it up to anybody. It's not a big deal. But is that normal to feel that pain while breastfeeding?
No, that is not normal. So I'm glad you asked that. Is it common? Yeah, it's really common. So we hear it a lot. Oh, I've heard it's going to hurt and the nipples will be cracked and bleed and it's terrible and it's really hard. But that's just getting started. And I heard it hurts in the beginning. It shouldn't hurt. A mom's nipple should be floating around at the back of a baby's soft upper palate. There shouldn't be anything pinching it, squishing it. So usually if there's any pain or nipple damage or discomfort during breastfeeding, somebody needs to assess that latch, because it sounds like the latch might be narrow or shallow, or there could be issues with oral structures like tethered oral tissues, tongue ties, lip ties, cheek ties, and things like that, that could be restricting a baby's range of motion, how well they can, what's the oral motor functionality like? How well can they move their tongue? How well can they reach that tongue out and cup that nipple and pull that into their mouth and then get it to the roof of the mouth, and then they make a wave, which paces how that milk flows and how they pull. So sometimes we have structural issues, so we do like a full oral assessment and check and see, do we have any tethers in that mouth? Is there a history? Sometimes there's a sibling who's had issues that had to be released, and so we can evaluate that as well. But no, it shouldn't hurt. It shouldn't hurt in the first few days. It shouldn't hurt, when babies first latch, but then get better. If it's hurting probably something is not right, and we should be assessing that latch and helping moms learn how to position in a way for a comfortable latch, an effective latch, ways that help babies not be super gassy. You know, if those lips are rolled in, then that baby's not got a great suction cup vacuum seal, and when they suckle, when they pull, it's not as strong, and they might be getting air, so you may have an uncomfortable gassy baby that rides around and has a witching hour, or might be leaking milk out of their mouth. And so feedings can take a long time. When we have a latch that's not comfortable or causing damage or pain, chances are it's not as effective. So just sitting down with a family and taking a look in baby's mouth, feeling what does their palate feel like? What is it like when they suck? What does their latch look like? Can we make little, I always like to think, can we just finesse that latch a little bit, tweak a few things, make a couple of adjustments, and sometimes that's all it takes to make it better. And so we may work with families through one visit or see them weekly for multiple weeks as they make progress on the journey. I'm always about progress, not perfection. When I meet with people, we're not looking for things to get perfect immediately. We're looking to see that the last time we met, here's where we were at. Are we in a better place than we were before? And then we will sort of build on that, because it's progress. It's a progressive journey, and it's not just one person. It's two people. We can't control this whole other little person. They come to the breast in their own way. They have their own anatomy.
So, Nicole, one of the last questions that I really want to ask you is that we're just talking about, breastfeeding, how babies suckling the breast and pain and things like that. So it leads me to ask, so if that is happening, or if babies are not getting enough milk, or they're getting air into their bellies and things like that, does that cause them to possibly either lose weight, gain weight? And how important is it for us to keep track within that first, 4 or 5 days or a week, as far as the baby's weight gain and loss? Is that important?
It's really important. Actually, they will get weighed shortly after their birth, and then they'll get monitored. Their pediatric provider or nurse practitioner who takes care of them will check them about 2 days after delivery. We expect some drop in weight because babies are born with a gut full of meconium and a belly full of pee, and they're going to pass lots and lots of stuff into their diapers, but only take back very small amounts of colostrum in those early days after delivery. So we know their weight is going to drop, and we watch it pretty closely. So anytime a family comes to see us, we're going to weigh that baby, and we track their trends to see, are they gaining appropriately? Are we seeing what we should be seeing in those diapers? If it's not coming out, that's kind of a concern that it might not be going in. So we watch what's happening in the diapers. We're weighing those babies somewhat regularly early on, and we can measure those feedings to see how much they're taking. We get lots of families who come and see us because their pediatric provider referred them because baby wasn't gaining a ton, and we can help develop a feeding plan for them. But if their latch isn't great and the seal is not good, they could be taking in lots of air. It can make them really uncomfortable. And if you imagine you were feeding and taking in a belly full of air, that tummy could be really full, and that baby might not have room to eat more, and then want to come back really frequently when they can finally pass all that air. So you might have a baby that's wanting to eat constantly, wondering, why is my baby, hungry all the time? But it just might be they're just distended and full of, swallowing lots and lots of air, not making a lot of room for food. So we're like kind of little detectives. We listen, parents will come in and tell us, we ask how it's going, they tell us the whole story, and we are listening, doing a lot of listening and picking out details and thinking, oh, okay, so we've got a really gassy baby and a mom with really sore, damaged nipples, and they're hungry all the time and the weight's not great. And we can kind of look and see what can we adjust, what might be leading to that issue. So yeah, we do track weight trends, we do measure feedings, we watch to make sure that they're doing okay and eating enough, and talk to the parents about early hunger cues. We have more success when we get these babies latched and start their feedings before they're crying, before they're frantic. The secret language of babies is here in the hands. When they first wake up and they're just freshly hungry, they're usually pretty relaxed or just starting to close. But when we see them with these really clenched tight fists, we've got a really hungry baby on our hands who may not be real patient with us when we're trying to get them latched, but we can also watch that same body language throughout a feed. And if you've ever seen a milk drunk baby, when their bellies are full, their hands relaxed, there's not a lot of body tension, not a lot of like recoil or tightness. So we teach parents to learn to read their baby's hunger cues and learn to read their body language and look at the big picture, so that we can make sure these babies are eating enough and they're gaining and growing and thriving and meeting all their milestones. Because when that's happening, everybody's in a really good place and happy.
Yeah. Well, I just want to also say this, and this is, again, I'm not a professional at any of this, but this just come into my head, is babies don't weigh a lot when they're born. So that weight gain, weight loss, not getting whatever weight they're supposed to be at, don't look at it as, oh, my baby hasn't gained 3 pounds in 1 week. It's what, 5 to 7% of the body weight when you first weigh that. So it could be ounces, right? Under a pound that makes that difference.
Well, from birth weight, we really hope babies do not lose more than 10% of their birth weight. When they reach that 10% threshold, we really need to look at a feeding plan that supports that baby. Maybe mom's milk is a little delayed coming in. Perhaps she had a postpartum hemorrhage or a super eventful or complicated birth that's delaying her milk coming in. Or maybe she has a health condition that's delaying milk coming in. So sometimes babies are ready for more than moms are producing in that moment. And if they're dropping weight 10% below their birth weight or more, we need to look at ways to support that baby, whether that's donor milk from a milk bank, whether that's formula, whether that's expressing mom's own milk, whatever she does have, and feeding it back to that baby. By around day 5, we want to see babies no less than 7% from their birth weight, and typically they will trend gaining on average about 20 to 30 grams each day, or close to a half an ounce to an ounce each day once milk comes in. And they should be back at their birth weight within that 2 to 3 week of age mark. Typically, most commonly, babies are going to get back to birth weight around day 10 to 14 if feeding is going well. But we track it closely. We have a threshold where we're watchful, where it bears watching, and then we have a threshold that we cross and say this baby needs a little extra support. And so we look at that and help make a feeding plan to support that family until everything's trending in a better direction for them.
I hope you enjoyed today's podcast with my guest, Nicole Salter, and learned something. Now, please remember to like, share, and comment. That always helps the algorithm. It also goes to show me that there are people watching, listening. And please remember, if you have any suggestions as far as topics or guests, please leave those in the comments or directly DM me or send me an email directly to podcast@chucktuck.com. Until next time, thank you very much and have a fantastic day. And remember, be a responsible pet owner and have your pets spayed or neutered.